Imagine your best dairy cow, healthy, producing milk, and then out of nowhere, boom, she aborts. The whole barn goes silent, your workers panic, and your profit starts bleeding. That's brucellosis, a sneaky disease that doesn't knock before it wrecks your herd. This isn't clickbait. Trust me, you don't want to sleep on this one. I'm Luna from VetiVerse, and today we're breaking down everything you need to know about brucellosis, what causes it, how it spreads, what it does inside the animal, how to spot it, test it, treat it, and most importantly, how to stop it from ever hitting your farm. Let's roll. Etiology. Brucellosis is caused by bacteria from the genus Brucella. Each species hits different animals. Brucella abortus targets cattle, B. melitensis goes for sheep and goats, B. sui infects pigs, and there are a few others. These bacteria are tiny but deadly, they love reproductive organs and milk. And here's the scary part, they're zoonotic. Meaning, humans can catch them too. So yeah, this isn't just a livestock problem, it's a One Health issue that connects animals and people. Transmission. How does it spread? Pretty simple, contact with infected reproductive tissues, aborted fetuses, placenta, vaginal discharges, or contaminated milk. Picture this, a cow aborts, the placenta stays on the ground, and flies, dogs, or even workers move it around. That's a bacteria party waiting to happen. Animals can also get it through ingestion, inhalation of contaminated dust, or during breeding, especially if AI tools aren't disinfected. Humans? Mostly from unpasteurized milk or direct contact during handling. Bottom line, if your hygiene game is weak, this bug spreads like wildfire. Pathogenesis. Now let's talk about what happens inside the body. Brucella enters through the mucous membranes or skin wounds and heads straight to the lymph nodes. Once inside, it hides inside immune cells called macrophages, literally hijacking the body's defense system. It multiplies quietly, spreading through the bloodstream to the uterus, udder, and other organs. In pregnant animals, it loves the placenta because it's rich in sugars and hormones that help the bacteria grow. The infection damages fetal membranes, killing the fetus and triggering abortion. That's why farmers see sudden abortion storms. In non-pregnant animals, it causes orchitis in males, infertility, and chronic infection. Animals keep shedding bacteria through milk or secretions for months. And since the bacteria live inside cells, they're tough to eliminate. That's why one infected animal can silently ruin a whole herd. Clinical signs. So, what do you see on the farm? In females, late-term abortions, stillbirths, weak or premature calves, and retained placenta. Fertility drops, calving intervals stretch out, and milk yield declines. In males, swollen testicles, painful scrotum, and poor semen quality. Some carriers look totally healthy, the silent spreaders. And if humans catch it, they'll feel like they have a never-ending flu, fever, chills, joint pain, night sweats, and fatigue that drags on for weeks. It's called undulant fever because the fever comes and goes like waves. Creepy, right? Diagnosis. You can't confirm brucellosis just by looking, you need proper testing. When abortion happens, collect samples from the placenta, aborted fetus, or vaginal discharge. Lab confirmation can be done by culture or PCR. Culture is the gold standard, but slow, while PCR is fast and sensitive. For herd screening, vets use serology tests like the Rose Bengal test, ELISA, or complement fixation test. Always confirm positives with another test because false positives can occur, especially in vaccinated animals. And please, safety first. Always wear gloves, avoid contact with fluids, and let the lab know you suspect brucellosis. You don't want to be the guy who brings Brucella home. Treatment. Here's the harsh truth. In livestock, there's no guaranteed cure. Even after antibiotic treatment, animals can stay infected and keep spreading the bacteria. Because of that, most countries don't treat, they test and cull infected animals, often with compensation programs. In humans, treatment involves antibiotic combinations like doxycycline and rifampicin, but that's strictly under medical supervision. Never try to medicate livestock yourself. If your vet recommends treatment for a valuable animal, weigh the risks carefully: residues in milk, risk of reinfection, and the fact that brucellosis is a public health hazard. It's better to protect the herd than to gamble with one carrier. Prevention and control. Here's the SMART playbook: prevention beats cure every single time. Biosecurity during calving: isolate any animal that aborts. Remove and properly bury or burn aborted materials. Never leave them in open fields. Use PPE, gloves, boots, and masks when handling calving or abortion cases. Farmers and vets can get infected easily. Test and cull, regularly screen your herd. Remove positive animals according to your country's policy. Vaccination: use approved vaccines like S19 or RB51 in cattle where allowed. They reduce abortions and spread, but always follow national guidelines. Control movement: only buy animals from tested brucellosis-free farms. Quarantine and test new arrivals. Milk safety: always pasteurize milk. Don't sell or drink raw milk. It's not worth the risk. Disinfect equipment: clean AI tools, buckets, and milking machines after each use. Contaminated tools are silent killers. Do this consistently, and you'll save your herd, your business, and your health. Real case example. Here's a quick story. A small dairy farm had 3 abortions in 1 month. Workers weren't using gloves, and they sold raw milk daily. The vet tested the herd, turned out it was Brucella abortus. They culled infected animals, disinfected the calving area, vaccinated the rest, and stopped raw milk sales. Within a year, no more abortions, and no human cases. That's what smart management looks like: prevention over panic. For awareness. Brucellosis is nasty but beatable. Test your herd, vaccinate smartly, protect your workers, and pasteurize your milk. And if you found this video helpful, smash that like button, subscribe to VetiVerse, and tell us in the comments what disease you want next. I'm Luna, stay sharp, stay safe, and I'll catch you in the next one.